Hi, I'm Casey Fry, and I'm here with Tom Bianco, physical therapist and part owner of Rehab Connection, located in South Jersey. Today, Tom and I will be talking about mechanical low back pain. So welcome, and thank you for joining us today.
Well, thank you for having me.
So my first question for you is, what exactly is mechanical low back pain?
Well, mechanical low back pain is any type of injury that occurs to the disc, spinal joints, muscular structures that are located in the back.
Okay, so how common is this mechanical low back pain, and how common is just regular low back pain?
Well, low back pain will occur in probably about 85% of the population under the age of 50. 15 to 20% of all Americans will experience low back pain at some point in their life, which makes it, high along the lines of disability in America.
What is the cause of mechanical low back pain?
Well, a lot of times it's trauma. But sometimes it can just be through repetitive strain or overuse injuries of the low back. We attribute a lot of it to postural stuff when you're doing activities throughout your course of your life, whether it be at work or playing around in the yard with your kids or that sort.
And obviously it's in the back, but what are some of the specific structures of the body that are involved with this mechanical LBP?
Well, a lot of times it'll involve the disc, and it kind of depends on how your therapists or your doctors are trained in terms of what they think the structures are. So it could be disc, it could be the spinal joints, it could be ligaments that help support the spine, or it could be the muscles in there too.
Now, if a patient comes in, how are they diagnosed with mechanical LBP?
At Rehab Connection, the way we diagnose it is we do a lot of repeated movement testing. We'll do strength testing. We'll put you through a bunch of different functional tests as well. We test reflexes and strength and go through a pretty thorough evaluation of your back and the pain that you're experiencing.
Okay, so if a patient comes in, would they get an X-ray or would they get an MRI?
Well, usually after the evaluation you can tell if it's mechanical or not. So if it's a mechanical problem, an X-ray, MRI, or CAT scan or any of the further testing usually isn't needed. We can usually treat them based on the way they present.
Okay. So what are some of the common symptoms of mechanical LBP?
Okay, so low back pain presents in a ton of different ways. It can just be central or kind of spread across the low back. It can radiate into the buttocks. It can radiate down into the legs. It can be pain. It can be tingling. It can be paresthesia. It presents in a multitude of ways, so we try to differentiate it out and kind of figure out what the source actually is.
So is physical therapy an appropriate treatment for mechanical LBP?
Well, since I'm a physical therapist, I would say yeah. I think it's probably one of the most common interventions for people that have low back pain. We take them through the evaluation. We do a lot of the testing that helps differentiate out the diagnosis and helps to speed up recovery.
So in working with patients with mechanical LBP, what is the ultimate goal of physical therapy?
Well, I think the ultimate goal is to get people back to their, to get them to be pain-free or have the least amount of pain as possible, but also to get them back to their prior level of function and the activities that they want to do. We try to teach them to be independent with their exercises, try to teach them to be self-sufficient in managing any symptoms that may occur in the future.
So if I were to have mechanical LBP, when should I start my physical therapy?
We think that the earlier that you can start therapy, the better. Typically the people that get in earlier get better faster. The longer you wait to try to resolve the problems, the longer it takes just to get better.
What would physical therapy for me really consist of if I were a patient of mechanical LBP?
Okay, well that's a good question. When we go through the evaluation, at the end of it what we'll do is we'll kind of go over the findings with you. We always explain spinal mechanics and proper posture and the posture that's right for you. We'll put you through some exercise program, again dependent on what your condition is. It may also consist of modalities such as ultrasound and heat and ice and electric stim. It may not. It may also include some manual stuff, and likely does, whether it be massage or joint mobilization or just general stretching.
And how long would that physical therapy last?
The therapy takes, typically we see people a few times a week. And it can take a couple visits depending on how fast you get in and what the actual cause of the pain is, or it could take up to a couple months. I mean, it really is dependent on a bunch of different factors.
So what are some things that patients could do at home to help speed up the healing process with their physical therapy?
Well, everybody will have something to do at home, whether it's basic and simple, just as maintaining a proper posture or positioning, or going through a comprehensive exercise program. So it's really important that they keep up with those programs, watch their body mechanics when they're going throughout their daily functions, and then keep us informed as to what's going on and what they're feeling and when they're feeling it. Because the more interactive they are with us and the more they can tell us, it helps us filter out possible problems and ways to make things better too.
You mentioned patients would have to watch their body mechanics and daily functions. Are there any daily functions that patients would have to stop doing with mechanical LBP?
Yeah, we try not to. I mean, we try to keep them as active as possible. We want them to move and want them to be, as normal as possible. But if something seems to be detrimental to the condition or to getting better, then we're going to have to, hold that off a little bit, or at least modify it probably.
So patients who develop mechanical LBP, from that point on, will they always be predisposed to low back pain?
Well, it's an interesting question and one that's kind of hard to answer. I think that, once you have pain, I think that there's probably going to be some source of pain in the future. But it may not be the same cause of pain. So because there's so many different structures in the spine that can be the source of mechanical low back pain, one instance might be a disc, for example, and the next instance might be one of the joints or one of the ligaments. It just kind of depends. But are you necessarily predisposed? You may be a little bit, yeah.
Okay, it's interesting. And so my last question is, what are some things that you can tell patients to prevent any future episodes of mechanical LBP?
So we emphasize body mechanics, body mechanics, body mechanics. It's so important to maintain a good spinal position when you're doing things throughout your daily life, whether it be work or play or whatever. But we also try to make sure that, when they're done with us, that they are going a good home program that they're comfortable doing and that they know how to do correctly. But we also want them to probably follow up with us, even if it's just a phone call, just to say, hey, this is how I'm feeling, this is kind of, where I'm at, is there something I should be doing differently? And then at that point we can make some additional recommendations for them.
Okay, well thank you so much for sharing your expertise with us on mechanical LBP.
Thank you, it's my pleasure.